The social aspect of urinary incontinence is always one of the biggest aspects I end up speaking with the family and the patient during a clinic visit. Most of the time, it is a social issue that drives the patient to be evaluated in the first place. Obviously, the most common symptom is wet pants, wet underwear, either in the day or in the nighttime. A lot of times, this can go along with such things as urgency symptoms. A lot of times, this is manifested by a child either grabbing themselves or sitting down to try to overcome the overwhelming urge to urinate at the time. First and foremost, what I tell parents is that they almost always resolve no matter what we do. And my role is to try to hasten that as much as I can. And when parents understand that this is the most common diagnosis that we see in the pediatric urology clinic, that definitely gives them some peace of mind to understand that they are not alone in this. The pediatric urinary incontinence can be broken down into two groups: daytime wetness and nighttime wetness. Daytime wetness usually affects a younger population. This is really defined as children who do not have total urinary control during the day. Nighttime urinary incontinence is essentially bedwetting. So a very common question that I have, especially during the initial visit, is why am I talking about constipation when they're here to see me about wetness? And the issue has to do with the fact that the bowel and the bladder are essentially consider the same organ as far as the brain is concerned. And many times, just simply by treating constipation, which the overwhelming majority of these children have, the urinary symptoms actually almost, if they do not resolve, they improve dramatically. As far as the nighttime issues are concerned, this is really avoidance of liquids 2 hours before bedtime, and making sure to empty the bladder before the child goes to bed. There are two other treatment options if the behavioral modification doesn't work. One of them being the bedwetting alarm. And this is essentially a very simple mechanism where a electrode that does not shock the patient at all, but is inserted into the patient's underwear, and then when a wick on the electrode is made wet by moisture, i.e. urine, a alarm is set off that either wakes the patient, or many times, because these patients are deep sleepers, the parents wake up, and over time the patient is trained to wake up by themselves before they urinate. The other option is a medication called DDAVP. This is an antidiuretic hormone that is used really more in short-term situations. It really masks symptoms more than it cures the problem, but sometimes this is the best option for patients. As far as daytime issues are concerned, another treatment option that we are now offering is something called biofeedback, and this is essentially pelvic floor rehabilitation. So Floating Hospital has recently acquired the capability of doing pelvic floor rehabilitation. Sensors that are placed on the pelvic floor allow us to tell whether or not the muscles are contracting in the pelvic floor. This is shown on a computer screen, and on this computer screen there are also computer games and illustrations that allow the patient to graphically control their sphincter muscles and learn to contract and relax their sphincter muscles more efficiently. Many times the children actually look forward to these visits because they are interactive video games, and the child earns points through performing certain tasks during the biofeedback. We are now establishing a presence in Framingham, and plan on establishing presence in the northern part of the state as well, to create an outreach program to offer this treatment for patients and families who may not be aware of it. We offer a whole range of different treatment options for urinary incontinence. We are also starting several studies that are involved in the evaluation of childhood urinary incontinence as well.